welcome to the CBIA BizCast powered by Google. My name is Ashley Zane. I'm a Government Affairs Associate here at CBIA. Today on our podcast, we're bringing you to Pathways Academy in East Hartford, where 69 students from Hartford, Public, New Britain, and East Hartford high schools presented final projects for their Ready CT internship, also referred to as GRIT, to their business clients. So we'll get into the program specifics in a little bit, but I'd like to introduce you first to Naomi Durant, who's a rising sophomore at Pathways Academy, and Melanie Tucker, the Vice President of Talent Management. So welcome to the podcast.
Thanks for having us here.
All right, so why don't we start with you, Melanie? What's your involvement with the program? How did you get involved? What's the level of involvement from Hartford HealthCare?
Sure, yeah, thank you. So Hartford HealthCare partners with Ready CT and Hartford Public High School. We became involved about a year ago. We sponsor the Allied Health Career Pathway at Hartford Public High School. We launched it just last year, so it's been a really exciting year for us. And it really aligns well with our commitment to the community and to our future workforce. We believe that there's a lot of career opportunities here in Connecticut and certainly here in Hartford. And we're just thrilled to be able to partner with local high schools and educate high school students to show them just the wealth of opportunities in healthcare and introduce them to the career opportunities they may have in the future right here in Hartford.
So that's really exciting. And what makes this internship a little bit different than a lot of other internships? You know, we have high school students, and typically when people think of interns, they think of college.
Sure, yeah. Well, this internship is project-based, so instead of having students come into the organization and work in specific areas, working with teams, these students are working in a collaborative environment, and they're working on specific problems. So, they are working with a team based in the hospital on a specific opportunity that's been identified over a 5-week period, and they really get to solve a problem and analyze data and come back and make recommendations to our leadership team instead of just coming in and doing sort of what you think of as an internship.
Yeah, that's really, really neat, really focusing on the project-based learning aspects. What kind of skills are you looking for, and what kind of characteristics from these interns really kind of make a superstar, in your opinion, in these internships?
I think first and foremost is the ability to work within a team. So, I think that collaboration is absolutely critical. And then, beyond that, I think, what this internship does is really allows them to hone different skills. So I look at the, projects that, Naomi worked on, and, they analyzed 12,000 line items of data, right? So they're learning critical thinking skills and analytic skills, and learning how to, present to management. So there's a wealth of skills that they're actually learning, but I think, really that interpersonal skill set is super important to actually bring to the table.
And did students get any kind of course credit for participating in the internship?
Students were actually paid to participate in the internship, and we're incredibly fortunate. It was all sponsored by Travelers.
Wow, that's really awesome to be in high school and have a paid internship. Mm-hmm. That's really exciting. So Hartford HealthCare is one of 5 businesses that partnered with Ready CT. Travelers, EY, Hartford Land Bank, and Stanley Black & Decker participated in the program as well. And each of the companies had assignments that they gave to these interns. So why don't we switch over to Naomi?
Okay.
And what were some of the things that you had to do to prepare for the internship? Anything mentally, any coursework, any discussions with Hartford HealthCare initially?
No, I did not initially speak to Hartford HealthCare. However, I did have meetings every Monday so that I can prepare for my interview, how to dress, how to work in school, not school environment, but a work environment, and being able to partner with other companies and people.
That's really cool. And how do you see this aligning with your future career goals?
Well, because I do want to work in healthcare, I was very excited to be able to go to the hospital and do activities and witness a lot of different things happening in the hospital because I do want to become a dermatologist.
Very neat. So did you have like the best day? Describe the best day on your internship. What was the most exciting part of it? You know, the best task that you got assigned, or the best, you know, leadership role you got to take?
Let's see. The first time we went to Hartford Hospital, we were able to engage in CESI lab courses, which was like their new technology for simulations of either like liposuction surgery, which got me very intrigued because surgery was one of the biggest things on my mind as well. But working at this internship, it really taught me teamwork and being able to take charge in different situations and scenarios.
So did you go into this internship with one mindset where you thought maybe you want to get involved in healthcare in this particular area, and then after going through the internship you realized, actually, I'm more interested in this pathway, or did this just solidify your interest in the specific area of healthcare?
When I came into this internship, I had no idea I would be working in healthcare, to be quite honest. When I realized that I was working in healthcare, it made me like open my eyes to more options in the hospital as like nursing or like surgeons, and even like some of the ER works, like we're either working at the desk or just working with patients. It had opened my eyes a lot.
That's really cool. And what do you think was the biggest challenge or biggest hurdle you had to overcome during the internship program?
Well, for me, I'm very shy, so working with a new group of people, especially like nobody from my school was in my group, so it was more of me just having to open up to other people, not knowing anything about them or where they came from.
Yeah, that can be really tricky even for, you know, adults, college students, everyone. So Melanie, we see all these bright students who are completing these projects. How do you see, you know, moving forward with them, keeping in touch with them, keeping them engaged in Hartford healthcare? What do you see your role in really, you know, maximizing this talent pool that we're seeing?
Well, we definitely plan to keep in touch. You know, so we were just actually having a conversation after Naomi and her team reported out. You know, their team came up with some really great recommendations, and you know, one we were discussing, we're already planning on implementing, and we have invited the team to come in once it's up and running to actually see their work up and running. And so I think that's how we envision staying in touch with them, right? Love to invite them in to see, you know, their ideas in action. You know, it really has been a pleasure. I think the work they've done is phenomenal. The presentations were incredibly impressive, and so I think, you know, continuing to stay connected as the students progress in their high school years and beyond is exciting.
Yeah. What was it like presenting to this group? I mean, you're presenting to vice presidents, CEOs. Was it nerve-wracking? Were you feeling really confident about your initiatives after all the hard work that you had done? What was that like?
Well, presenting is not very hard for me, but being in like a lecture hall with like levels of people being in there, it was actually very nerve-wracking. But I ended up seeking it through. I was comfortable after a little while, and when I had to present again today, I wasn't as nervous because I already knew what it felt like to be in front of a lot of people that I didn't know.
What was your favorite initiative? Like, which initiative are you the most proud of that you developed with your team?
I would have to say probably leadership, because my teammates, like we got along easily very well, but like helping my other teammates with struggling with either their work or like their slide, I was able to help them project their voice and be able to know and understand what they're saying.
That's really cool. So why don't you give us a little bit more of a description on the project that you worked on?
So our project name was Talent Development. So that was mainly us working with human resources and knowing like their problems that they're facing with their employees. So we had to create solutions and recommendations. We had to analyze data so that we could help human resources gain more ideas from a younger generation perspective.
So going into this, you're dealing with high school students. What were your expectations? What were you most impressed by? Any kind of insights into the program?
Yeah, so going into this, I really wasn't sure what to expect, given this was our first time, doing grit. I have to say it surpassed my expectations. The work product that the team produced was incredibly impressive. They came up with some insights that we really hadn't thought about, and I think having perspectives from a younger generation was just really insightful for us. And there are a number of initiatives that they've recommended that we're already starting to make plans to. A couple things that they identified that I thought were really impressive is, since COVID, they identified that, the number of individuals that actually received job offers but didn't actually start doubled.
Yeah.
And so I think the fact that they identified that is really impressive.
Mm-hmm.
So in healthcare, we're obviously seeing a workforce issue. We don't have enough people to fill the jobs. How do you see this program, helping to fill those jobs moving forward and really filling that job deficit?
Yeah, it's such a great question. Healthcare is the fastest growing industry organically and will be probably for the next decade. And it is, the reason we chose the project that we did choose. And so just coming up with creative solutions on how we retain our employees, how we develop them, is critical. And so having a fresh set of eyes come in and give us suggestions, look at the data in ways that perhaps we didn't, was incredibly valuable for us. And the team really did, give us different perspective than we had previously. So continuing that kind of work and continuing to bring in sort of that diversity in thought will be something that we want to continue to leverage in the future.
All right, well, thank you both so much. Thank you, Naomi. Thank you, Melanie, for taking the time out to join us on the podcast.
Thank you so much.
Thank you.
And thank you for listening to this week's BizCast. You can listen and subscribe to our podcast on Apple or YouTube. And for more episodes, head over to CBIA.com.